I don't know if you can see that I have a crooked nose, and it really has been causing a problem with my breathing. I would always have to sleep on my right side to pull that open so I could breathe, and I thought it was just a deviated septum, which I did have surgically removed about 20 or 30 years ago, and it didn't help. It went right back where it was. But I recently had a cavitation repaired. It was the most amazing thing because after, in fact, the next day, it was kind of like somebody had pulled something out of my sinus and I could breathe. You know, sometimes you don't know what you've got till it's gone. It has been amazing. And then we followed with some detox to kill some of those pathogens from the cavitation. I'm Tammy Stewart at Health for a Purpose, and I want to introduce Dr. Coats, who is my favorite dentist, and she's going to tell us a little bit about, Dr. Coats, start with, what is a cavitation?
Cavitation has a broad term where it's basically bone that is diseased bone or dead bone.
Okay.
You can imagine cavitation with the root of that means hole, cavitation.
Oh, okay. I never considered that. Yes,
So,
that's brilliant.
Hole in the bone, which really sounds kind of scary when we're talking about
For sure.
it's us and how did that happen when we try to live our lives healthy.
And what's that going to do with if I've got holes in my bone?
Right. What does it mean?
20 or 30 or 40 years from now.
Right. So the point being with that is it's bad bacteria. The bone is not reacting well with it, so the regenerative process needs to change.
Okay.
And so there are ways to identify cavitation. Sometimes it's called osteomyelitis, which is inflammation of the bone.
Got it.
Because there's bacteria.
Right.
And
so let me back up and say, so the way I understand it is there's a hole in the bone where the bacteria are living. So it's an infection.
Right.
Got it. Thank you.
Right. So if you keep having the infection...
Does it hurt?
No.
Ah, that's tricky.
So that's tricky because we all are human, that if we have pain or hurt, then that's the problem. Versus it's still in our body, which if you think about it, that can explain why there are many different things going on with your health that you cannot connect.
A wide variety of symptoms that seem unrelated. Maybe you have... My example, sinus congestion. If I went to several doctors and none of that helped, because in order to solve any problem, you have to remove the cause.
Yes. Have to remove the cause. So the point being is that you may not have pain with it. How can you find it or diagnose?
Right. Good
That's
question.
what everyone wants to know. So if you go to a dentist and you have some x-rays taken at some point, you are really going to want to look at what's called a cone beam CT. So that's not the same as a two-dimensional x-ray. And the reason for that is that they can be missed. Some dentists, just with the information that's provided, you wouldn't be able to see it. Hence, still maybe having problems with your health. So my recommendation would be to have a cone beam CT. I have one in my office. That's where you can find, diagnose, and inform our clients.
And that machine is really hard to find, number one. And number two, it's hard to find a dentist who has the machine and knows how to use it correctly. Correct. That's a huge skill. And then what to do about it. Because let's say I found someone who had the machine and miraculously knew how to read the x-ray, but if they don't repair it correctly, then it's still not going to solve my problem.
Correct.
So tell us about how you, well, show us the x-ray.
So let's zoom in here. So this might be something that your dentist would look at, and this happens to be root canal teeth. Again, they are dead teeth. So toxins at the tip of the tooth, which do not hurt. There's no nerve in the tooth, so you're not going to have pain. So there's no nerve. You might see something suspicious. The dentist says, I want to watch that. Watching really just means you need to actually look further, find a cone beam CT, and find the answer. Not watch and wait for it to get worse, such as my face swollen, or my sinuses hurt so bad I can't breathe or sleep correctly, just like Tammy was saying. So this is not a cone beam CT. This is just like a two-dimensional x-ray. If you want to see what is different for your dentist to diagnose, this is what I have in my office. So this is looking at someone that had a root canal And this is where they had, again, remember cavitation, abscess, hole in the bone, or called osteomyelitis, with no pain.
Mm-hmm.
Here's the thing that might have been very similar to Tammy's experience, is that this is an upper left molar, so like right under your eye and your sinus. So how you three-dimensionally blow up looking at the bone, you can actually see in cross-section, this is what the abscess looks like. So it's a hole in the bone, and it happens to be at the very tip of the root canal. It doesn't mean that the root canal wasn't filled, but it means that there was still bacteria past where you could fix with the root canal, and it just stays and festers there, and you can't clean it, even though you might be brushing and flossing your teeth. It's just in your bone. And this is where people can have chronic sinus problems, because the infection basically ate its way through the bone into the sinus. So that's why people say, I always have drainage or clogging, or I can't sleep well, or there's pressure, or always are on allergy medications, or I see an ENT and they're constantly helping me. The dental component is not being looked at, which is contributing or a cause to the inflammation in the sinus.
And you know what's interesting, as you were saying that, the cavitation that I had repaired was on the bottom. It wasn't even on the top. So it's a whole body bacterial issue. The bacteria are causing problems in the whole body, not just in the head. That's how it can be relevant to the entire body because of the inflammation. So tell us then, I think we understand that cavitations can cause a variety of symptoms, even without pain. We understand what is a cavitation. Tell us a couple more things. How does it happen? What can cause it?
Well, so if a tooth dies, which sounds really weird, like your tooth could die, and how would you know it, is probably what you're thinking. So a tooth can die because of, let's just say, we clench our teeth.
Oh.
And so all the pressure causes inflammation. The nerve over time just is tired of dealing with inflammation. So just like other cells in our body, they can degenerate, die. When they die, they release toxins. The toxins go to the exit point, the tip of the tooth. So like any tip of the tooth, it'd be down here if it was a lower tooth, or it'd be up high if it was an upper tooth. So that's where the bad bacteria will stay and live in the bone, and then cause the bone to react and degenerate, hence call a hole in the bone or cavitation, inflammation process, and then eventually, because there's no pain, later on, if it's not addressed, then that's when someone says, I have a pimple in my gums. And it just showed up. Well, it did not just show up, it had been there for likely years. Or they say, oh, my face swelled up, or I felt like I had to go to the emergency room.
So what about wisdom tooth extractions? With my clients, that's my first red flag. If you've ever had a wisdom tooth, because in our experience, 80 to 90, probably over 90% of typical wisdom tooth extractions end up with cavitations. So tell me a little bit about how would you repair that?
So again, if you can look at cone beam CT, you're going to be looking at what does the bone look like when it heals. So maybe a picture to illustrate that point that's pretty common would be when bone does not heal well. This is exactly Tammy's point. This is a wisdom tooth, a last molar, third molar. So I don't know if any of you ever had wisdom teeth taken out as a kid, and you might not remember you were asleep, sedated, and you took the wisdom tooth out, and many people cringe about wisdom teeth because they know so many people that had a dry socket. Dry socket, if you think about it, you lost the blood clot, meaning you did not heal. So to make it really simple, if you don't have blood helping you heal and regenerate, plus maybe you had infection to begin with, it's just festering there in bacteria and never healed out completely. Maybe you had a dry socket, maybe you didn't, but then it closes over with that same bacteria. So why can you have a problem after you took out a third molar? Well, here's someone that did but there was still lingering bacteria left over. So the point being is that your biological dentist, this is how I can help be a resource. When you remove any tooth in the mouth, you should properly clean out the bacteria. And that's something maybe at another time we can visit with our audience about how you use ozone to have correct healing after any tooth removal. So then the end result is not still bacteria in the bone and a cavitation.
And so what, if you had to have that tooth extracted, how could it be done differently to prevent having a cavitation?
So you would do more than remove the tooth. You would remove any old bacteria. And I know that sounds really weird, but it's basically like an abscess. You know, if we've ever had like abscess, just think about like scar tissue, right? Like thick tissue. And so it's basically the body releasing toxins. So in the bottom of the tooth extraction site, you would want to clean that bad tissue or dead tissue out of the body. At another time, we can show you what that really looks like, but that's basically it. Cleaning out bad tissue, cleaning the bone, because you actually want bleeding. You want bleeding on the extraction site for stimulating the bone to heal with bone coming in to repair, called osteoblasts.
So one thing that we see in our work, because one of our specialties is healing from Lyme, is that one of the questions we ask our clients is, did you get a dry socket? Not because Lyme causes a dry socket or that dry socket causes Lyme. It's that when you get a dry socket, that's a symptom. And that place, that warm, soft, secret place, is a place that Lyme bacteria love to live. And the past probably 5 to 7 years, we see so much more Lyme simply because we have tests now that are very accurate at identifying that Lyme bacteria in the body. So with what we do in our work is after a client has had a cavitation repaired correctly, then we also work to those bacteria. They are so smart, so smart. And they will run all over the body to try to hide, to find a new home. And so at least 1 month after a correct cavitation repair, we'll have our clients take a variety of herbs that kill bacteria to be sure that any of those little guys that sneak out, that we can kill them so that they don't take up residence somewhere else in the body and cause inflammation that causes dysfunction. So is there anything else that you want to add? I think we've covered what is a cavitation, how do I know that I have a cavitation? Right. You have to get the right x-ray. You can't go by symptoms. Right. You have to choose the right dentist to repair it correctly. Right. Many dentists don't even know what a cavitation is. So that's one of the questions you need to ask when you interview a dentist.